And now the rest of your stuff. So far, we've done AKI, CKD, and the people that just came in, you're going to remember because I'll do it again for you guys later. We did AKI, CKD, end-stage renal disease, transplants, dialysis, diet labs, meds, diuretics. Now easy shit. Kidney stones. You, of course, have a handout on kidney stones in your renal packet with the lady on the front. Sweetie, if you got your old packets, those are much better because they're going to have your notes on them already, and I'm going to tell you what to highlight. So look for your old renal in your book bag. You got your old one like this? Yeah, if you got yours, it's so much better. Yep. That's it right there. You can give me that one because you probably don't need it. Just the top. Just the top. There you go. Did you bring yours, honey? No. Why? Oh, I understand that, child. You got to get here when you can. Okay, well, get your little packet out. Look for your kidney renal calculi handout. And it's in the middle of the packet. And right after that is the famous UTI lady. Now, your renal calculi. Remember who this is. I call this guy Hungry Jack. Remember how you guys said you had this word? You had something called urolithiasis. This was a type of urolithiasis, but it was in the kidneys. So urolithiasis is fine. Lithiasis just means stones. All right, so this patient has a typical profile. It's usually a man. He's usually not drinking a whole lot other than alcohol, maybe a six-pack even. He's not moving very well. Maybe he drives a truck for 19 hours at a time. Who knows? He's Hungry Jack in the sense that he's a big, husky guy. He is, his idea of nutrition is the tomato on his Big Mac. So he does a lot of fast food. And when he comes in, he looks like a lady in labor. Because indeed he is in labor, but it's not a baby. It's a stone moving through a very tiny hole, and the stone itself is not round like a baby. It's got jagged edges, and it's ripping through him. And so he is balled up, and if you look at the handout, it's all him. He's vomiting. He's got flank pain, groin pain. His balls are hurting. All kinds of shit is going on. He's got all of a sudden sharp, sudden, severe pain, everything on the list. Hematuria, common, because you're ripping things. Next to that, put the word cast. RBC, cast. So the complete blood count will come back positive for cast, and you'll see cast in the urine. And it just means that the red blood cells were injured. And they were injured because you put the stone in there, falling through the urethra and the ureters. Dysuria, ooh, it hurts to go. And he's going a lot, so he's miserable. Now, can ladies have this? Absolutely. When do they get it? Pregnancy. Very often they can get it in pregnancy or an older lady. Younger women with it is kind of rare. That really means they're doing too much and not really drinking a whole lot. Risk factors, you already see. We talked about it. We said dehydration and mobility. You want to highlight the uric acid because that's going to play a role with diet. Family history, definitely. These do run in the family. Urinary stasis and retention, you didn't go. You should be going every 2 to 4 hours, nurses. Of course, we don't go either. We take 12-hour shifts and we go once. So you might be at risk of this. This patient is taught to strain all their urine. Strain all their urine. We may use allopurinol if you go down by the uric acid on the bottom. We may use, if you put it right next to the uric acid note, we may use allopurinol to decrease that uric acid. As you know, if it's a uric acid stone, we're going to use allopurinol to decrease it. The diet for this guy is usually low protein, low calcium, which includes decreasing the intake of meat, beans, dairy. So low calcium, low protein is a good idea for this one. Lithotripsy. Have you guys been taught that? Okay. Lithotripsy is a procedure where we blast your stones with laser, and it does cause bruising. That's totally normal. It can cause some hematuria, like a little pink urine, and the bruising is all over their back. It's all over their abdomen. You don't want to be on like a blood thinner before this. That would not be good. We'd have to stop that. There's no incision. There's no cut for lithotripsy. It just is what it is. Blasting your stones away. Okay? But the thing about it after lithotripsy is tell them to strain all their urines. Keep straining their urine. Because we'd like to analyze the stone and figure out what diet to put them on. That would be ideal. Okay. Flip the page. UTI. Easy. This is 3 things classically. And I want you to highlight the 3. They're already written on your sheet. You're just going to highlight. What are you doing? What are you doing? What are you doing? What are you doing? Okay. Okay. So here we go. Number 1, frequent UTIs can lead to bladder cancer. And then I'm going to have you highlight the 3 signs on the side that you need to remember. Frequent and recurrent UTIs can lead to bladder cancer. I remember getting probably about 3 to 5 UTIs a year. It was really bad, and they're very painful. And I thank God for a good doctor who told me this. And she said, every time you have one, you've got to track it because we're going to need to suppress your infection rate because you could get bladder cancer from this. I was like, oh. So she put me on a medicine once a day for 6 months, and I didn't get another UTI for 10 years. So I really thank God for her because she allowed the scarring to heal up, and you know, and very few people know that these frequently will lead to cancer. Now, if you look on the left-hand side under cystitis, I want you to highlight frequency, urgency, dysuria. Those are classic 3 signs. Classic, select all 3 signs of a UTI. You gotta go a lot. That's frequency. Gotta go right now or I'll pee my pants. That's urgency. And of course, burns when you go. That's dysuria. And the only other thing I would say put a little star by is the confusion in the elderly. And I think I have that even for your post-op notes down the road. Okay, so you can have some confusion. All right. Now, pyelonephritis is on a whole nother level. If you go to the very bottom of the page, on the right-hand side, most important thing you can do to remember about pyelonephritis is they have to be hospitalized, and we give them their antibiotics through their IV. It's the same symptoms as a UTI. So if you look over on the left-hand side, it says that at the bottom. Same signs and symptoms as a UTI or a cystitis. Except you need to add chills, fever, vomiting. It's already there for you. Just highlight it. Chills, fever, and vomiting. This is more systemic. Use that word. Systemic. Pyelonephritis is more systemic. It's on there. Oh. Okay, it's on there under flank pain. Now, if you go on the right-hand side where it says pyelonephritis, you did have to monitor for urosepsis. Does everybody see that? Urosepsis is a big time word you care about. Urosepsis is basically going to lead to septic shock. It is where the infection has gone from the urinary tract, which is called ascending. It's going from the urinary tract up to the kidneys. So in your notes, it's like lower genital urinary infection, upper UTI, urinary tract infection. So lower is just simple. It's bladder infection. Upper is kidney infection, pyelonephritis. But you can't have kidneys being infected if it didn't start lower. So it goes up, and then with urosepsis, the E. coli gets in the blood, correct? Okay. What am I going to use for that patient? This one, lower urinary tract infection, what am I going to use? Bactrim, yep. Depending on the culture and sensitivity, but Bactrim's number one. I could also use macrobid, nitrofurantoin, so I could use one of the two. If the patient is not allergic to Bactrim, that is the first choice, as long as the sensitivity comes back fine. If the patient is allergic to Bactrim, like I am, then macrobid would be okay. What is pyridium for? Pain. It is not an antibiotic. It's for the pain. The side effect is nausea, vomiting, diarrhea. It turns your urine what color? Orange. Okay. And you only get a limited number, like 6 tablets. So you don't get like a week's worth. You only get enough for a day or two because it's not something you want to use long term. Pyridium is in here too, somewhere probably the next page. Pyridium is in there. How to prevent a urinary tract infection's in there. All that good stuff. Somewhere in the midst of your travels, you'll see pyridium in there. Okay, so that's about as exciting as it gets. You do have a select all list of what not to do. It's pretty simple. I mean, you get it. Don't forget toileting in the elderly every 2 hours. Toileting in the elderly every 2 hours. So where it says empty bladder regularly, you can put every 2 hours. Okay.